This next section will demonstrate the ruptured ectopic scenario. If that scenario were being run the same fashion that it's run in the Chloe workbook, the participants would already have seen the patient in the emergency room. They would have made a diagnosis of ectopic pregnancy. They would have noted Chloe's hemodynamic instability. They would have quickly have moved her to the operating room. She would have then, of course, been assessed by the anesthesia team, intubated, and now be ready for surgery. This demonstration will be done with uterine assembly number 2. That is the assembly that has an enlarged uterus, an ectopic pregnancy, and an immature teratoma. We're going to do a laparotomy on this simulated unstable patient. Take it that way. And another one this way. Thank you. And now we'll stretch that out a little bit more, Javier. See a little bit of the simulated blood there. Now we're cutting the fascia. And we're going to take our incision laterally. Okay, thank you. We're going to add Coker clamps now and demonstrate a fan and steel incision. Will you take those? You can drop that. Take those. You can drop. Put that one here. And with maybe with scissors, put up like that, please. Thank you. All right, let's move down. I'll take that. You move this retractor up here. Thank you. And you can see the underlying peritoneum. Let's put this retractor in here, on here. Let's put that retractor on the other side. We'll carefully incise the peritoneum. You can take that out. You can take these off. Just like a real patient, we're going to stretch this out. Alright. Now we will place our self-retaining retractor. One of the things I've noticed when residents do this case is that many of our younger residents have never placed a self-retaining retractor, because they do so much laparoscopic work. And that kind of demonstrates the value of surgical Chloe. When residents do a laparotomy today, it's a very difficult case. So they need some easy cases. And what I found is that they don't know how to place a self-retaining retractor, so they think that Chloe's musculature is too hard for them to open, but the reality is they just don't know how to use a self-retaining retractor. So as you can see, there's plenty of room there. So our patient's open. She's got her ruptured ectopic pregnancy. Let's find it. And there it is, and it's actively bleeding. So Julio, we're going to put Javier, we're going to put a clamp on that. Why don't you go ahead and put a clamp across that ruptured ectopic pregnancy there. There we go. Hemostasis is maintained. So we're now going to remove the ectopic pregnancy. And we'll send that specimen away. Now that the salpingectomy has been performed, the surgical team will close the patient's abdomen. Surgical Chloe will then be transported to the recovery room, but the surgical team should go to a debrief session. The debrief session will cover issues such as surgical technique and diagnostic capabilities. Unit assembly number 2 remains within the surgical mannequin, ready for the next procedure.